The project did focus on reducing the risk of dementia, and I'm sure you're all aware, but the Canadian population is aging, and aging very rapidly. So with this also comes a rise in the number of cognitive impairments. So we do see a rise in the number of individuals that have dementia. And the health impact and the socioeconomic burden of dementia really cannot be overstated, as the percentage of Canadians over the age of 65 is projected to actually double in the next 20 years. And there's some really pretty outstanding stats from Statistics Canada that indicate that as of 2016, over 900,000 Canadians were either directly or indirectly affected by this chronic condition. And estimates suggest that 1.1 million Canadians will be living with dementia in the next 10 years. So while aging is an important risk factor for dementia, it's really important to know that what we think of normal aging, dementia is not part of that. So there are many modifiable risk factors that we can do in order to reduce our risk of dementia. And in fact, 35% of dementia risk factors are modifiable. So there's a lot that we can do. It's not just age and genetics, so we can take action towards our health. Okay, so for example, did you know that only 15 minutes of physical activity can increase your life expectancy by 3 years? That being socially active improves health and well-being, and that secure relationships are actually the most predictive variable of well-being in later life. Positive thinking about aging, so thinking positively about the aging process, can actually prolong your life expectancy by 7.5 years. And in healthy adults, cognitive training can have long-lasting impact on cognitive test performance by up to 10 years. So really not small numbers. Really big things can happen if we just take some small steps towards our health. Physical activity is the best promoter of brain neuroplasticity across the lifespan. And all forms of physical activity help. So often we hear about physical activity as trying to achieve this 150 minutes of physical activity a week, but really it's just getting up. So just breaking bouts of sedentary behavior makes a really big difference. So thinking about just standing up and walking around the block is very valuable.